Hey guys, today we are going to tackle Chapter 12 vocabulary. I am, as you can tell, doing this from my front porch and trying to enjoy some of what's left of the beautiful day, the beautiful weather today. So I hope you guys got a chance to get outside today too. The first one is Aseptic Techniques. Okay. Many of you are going to find out next year in midterm that A means without, and septic means infection or illness. And so these techniques are techniques to prevent infection, okay, or the transmission of disease. So these are practices used by healthcare professionals to maintain a pathogen-free environment and prevent the transmission of disease. We're going to get to exactly what a pathogen is here in a little bit, okay, but it's those techniques that we use to prevent the spread of disease. Very, very common. We're using lots and lots of these techniques right now in the hospital. Bloodborne pathogens standard. Okay, bloodborne meaning that it's within the blood, pathogens meaning disease causing. So we're going to get more into that later, like I said, but it's those pathogens that can be spread through blood. So the standard is simply a OSHA regulation that keeps employees safe from having exposure to blood and other infectious materials. Okay, so some of those standards are us wearing gloves and us knowing what we're being exposed to, knowing the some of the high-risk bloodborne pathogens in different patients, knowing whether there's a risk there or not. Chain of infection. That is simply those things that are required for an infection to spread from one source to another. So that varies based on the mode of transportation or transmission, which we're going to get to. That's another vocab later in a little bit. But it's basically those things that are required. So if I'm completely masked up, I have a gown, I have a mask, I have a shield, the chain of infection is much less likely to spread because I have all those barriers of protection between me and a patient. Drug-resistant bacteria, okay? Simply bacteria that isn't affected by certain drugs anymore, okay? So strains of bacteria that have adapted and are no longer controlled or killed by normal antibiotic treatment. Okay, so we have lots and lots of these different strands that have changed and adapted, mutated over the years, sometimes over months, and then just the standard antibiotic won't kill them anymore. So then it takes on a further course. This is an example of COVID. Okay, COVID has changed. It's mutated a little bit from what it started off. And so that's why it's a little bit more challenging because we don't have a great way to treat it. Hazard communication standard. It's another OSHA regulation, and it's just simply trying to promote awareness of hazardous substances and understanding of safe handling practices. So years and years ago, blood was one of those hazardous substances, okay? And so now it's common knowledge that if you're going to deal with someone else's blood, you wear gloves. Okay. And we don't, we're careful with the way we handle someone else's blood. Those are different hazards. Okay. It will be very interesting in the coming months, coming years to see how this COVID evolves into something like this. Okay. Is it something where maybe healthcare workers always have to wear a mask from now on? I don't know. I'm totally stretching and drawing. So don't tell people that Mrs. Webb said that healthcare workers are always going to have to wear a mask. But, a long time ago, healthcare workers didn't wear gloves all the time until they found out how hazardous different people's blood can be. And so now that's a hazard communication standard. Healthcare associated infection. Okay, this is when someone enters a healthcare facility, most of the time being admitted, and they don't have this infection. Okay, So it's an infection that is not present when the patient is admitted to a hospital or healthcare facility, but one that develops within 48 hours or more after they're admitted. Okay. Sometimes called other things, but for all purposes of this book, they call it the healthcare associated infection. Okay. So somebody comes into the hospital and for some other issue and they leave with COVID or they develop COVID while they're in there. Occupational exposure. This is a big one that came up today in my world. Okay, guys. Obviously, I've been working at the hospital a lot with lots of exposure to COVID. Okay. Especially early on, we would have potential people coming in nearly every day. Okay. So I would wear my mask. I would, stand as far away as I could when I took their temperature. I paid attention to whether someone was coughing or sneezing or, exposing me in that way. Okay. But this is the term that we use for, a reasonable expectation for contact with blood or other infectious materials during the performance of job. Okay. So I kind of take on that occupational exposure when I'm going to work every day. I know that there's a possibility that someone may cough or sneeze on me and I may get COVID. Okay. When I'm at the high school, there's there's an understanding that I'm going to come in contact with blood, and that if I don't glove up and wash my hands after I'm done and use hand sanitizer and those kinds of things, I'm going to potentially come into contact with hazardous infectious materials. Today, I actually received notice that there was an exposure. And so now I have to take extra steps. Okay. I'm monitoring my symptoms, which I don't have any, but I'm monitoring my symptoms. I'm taking my temperature and those kinds of things to make sure that I'm not coming down with COVID. Pathogen. It's simply a disease-causing microorganism. Okay, so all those other times when pathogen is used in our definition of something, it's something that causes disease. Okay, literally in med term, you will learn next year, gen means causing, generating, producing. Patho means disease. So it simply means producing, generating disease. Resistant. That's a word that we use all the time in our everyday lives, I think. Not susceptible or able to survive in negative conditions. So we have all become very resistant to this situation. Okay. We have found a way to survive. We have found a way to continue to learn. Not maybe in the best way, or maybe the as much information as we would learn if we were in a traditional classroom, but we have all become resistant to all those negative things that are happening in the world around us, and we're continuing to survive. We're continuing to learn in this situation. Safety data sheet. Okay, very long time ago, this was one of my jobs, was to manage the safety data sheets when I first worked at the hospital. Okay, OSHA required document that explains the hazards of a chemical product. I challenge each of you to go into your cupboards and find the information that outlines the hazards of some sort of chemical product in your house. Okay, for every chemical, every cleaner, every product that the hospital uses, there is a filing of the safety data sheet. Okay, it explains what to do if someone gets it in their eyes, if someone gets it on their skin, if someone drinks it. Hopefully that doesn't happen too often. But any of those things occur that are out of the normal use of it, it explains how to deal with that and how to keep it from being potentially catastrophic. Transmission-based precautions. Okay, so these are just extra techniques, being extra careful, that are performed in addition to standard precautions based on how the patient's infection is spread. So, like we talked about, bloodborne pathogens, okay? If I know that someone has a cough or a cold, what am I going to do after I'm done? I'm going to wash my hands like I always do. After every patient, I wash my hands, okay? But if I know that they have some sort of bloodborne issue, I'm going to put gloves on, okay? If I know that they have a droplet based COVID, okay? If they have a droplet based illness, I'm going to wear my mask. I'm going to put on my face shield. I'm going to probably put on a gown. Okay, those are based on the transmission method, okay? It changes the different level of precautions that we take for dealing with that patient. Airborne based precautions. If you remember the last couple chapters, what we've done is just pull out all of the vocab kind of terms, the highlighted words. And so that's what I've done with this chapter as well. So this is another key term is airborne-based precautions. So these are those practices that we use when an infection can be spread over a long distance and through the air. Okay, so an airborne based precaution. When I'm coughing, sneezing, and it lingers in the air, or me breathing it out into the air, and then I'm out of the room and someone comes in a few minutes later, if it's still in the air, then we have to take those airborne based precautions. Okay, so something that's spread through the air. COVID isn't spread through the air, it's spread through droplets, which we're going to get to in here in a second. Carcinogenic. This is a word that we've probably all heard many, many times, but it's just cancer causing. Okay, so things that are carcinogenic, smoking, cigarettes, okay, all those things are carcinogenic. Tanning beds, the sun, okay, all those things are cancer causing or carcinogenic. Clean technique. It's the practice of disinfecting any object or surface that has come into contact with pathogens. Okay, it's pretty simple. That's a pretty easy word for us to get. Clean technique, the disinfecting of anything. Okay, so right now I'm practicing clean technique on my desk at work. Okay, that sits right inside the hospital. I'm using it on wheelchairs. I'm using it on ink pens. Okay, we have a bin of clean pens and we have a bin of used pens. And when a patient comes in and needs to use a pen, we request that they take one out of the clean pen, they use it, and then they put it in the dirty pen, and then we wash it. We sanitize it before it gets back to the clean pen, okay? Clinical Laboratory Improvement Act. As you can tell, this is a regulation. Okay, it's a government act that regulates how laboratory tests should be performed and then how those test results are interpreted and reported. Contact precautions. Here's another one of those different types of precautions based on how something is spread, okay? So this one is when a patient or when an infection is spread by direct or indirect contact with a patient or his or her environment. Okay, I've talked about this. I don't think I've talked about it with you guys, but I'm not sure. But I talked about several times about some skin issues, okay, some skin illness. This is an example, contact precautions are an example of skin issues. So way back when, when dinosaurs roamed the earth and Mrs. Webb was in college at University of Indianapolis, okay, I was working with the wrestling team. It was my very first day working with the wrestling team, and I hadn't even been in the wrestling room yet, okay? But the wrestlers came into the training room. Like all of you guys that are athletes, they touch everything, right? We touch everything that's around us. I think this COVID time has made me more aware of how often I touch things as I'm walking by. Touch a handrail that I don't really need to touch, or touch a doorknob or whatever. But okay, so the athletes would come in and they touch everything. Well, lo and behold, that first day, I didn't ever get into the wrestling room. I had paperwork and work to do in the training room, okay? But my wrestlers had come in. The next day, I woke up with a little lesion right here, okay, just on my upper lip. Within the next couple of days, it had spread and taken over my whole face, from basically my nose down to my lower lip. It was all over, okay, of impetigo, okay, extremely contagious, something that's spread by indirect or direct contact. I had not touched a wrestler and his impetigo. He had touched his impetigo at some point, whether it's on his arm, leg, whatever, on his hands. He touched it. He touched the countertop. I touched the countertop, and then I touched my face. Okay, that is an example of indirect contact. Now, if I had touched the patient, if I touched the athlete on his impetigo, and then I touched my face or my arm or my leg, that's direct. Okay, but indirect is when it lives on these surfaces and we don't even have to have contact with the patient. We can touch something that they've touched. Those are these are special practices that we take when something can be spread that way. Direct contact, we got into that here a little bit on the last definition. But it's that physical interaction with an infected patient, surface, fluid, or object. Okay, so directly touching the patient, directly touching the surface that a patient has touched, or the fluid, or an object. Droplet precautions. This is what we're talking about with the COVID. Okay. Practices when a pathogen can be transmitted through close contact with the respiratory system or mucous membranes. Okay, so this is that coughing, sneezing, anything like that, where these droplets, anything from the respiratory system is expelled and something can be transmitted that way. Oh no, my husband's finished mowing. He's going to come join in our video. Federal Needle Stick Safety and Prevention Act. Okay, it's a government act that requires healthcare facilities to use needles specially engineered for safer injections and blood draws. We're not going to get into that a whole lot. I don't think it's crazy important for this class, but just at least recognize that act. Fomites. Simply contaminated objects. So like we've talked about with COVID in the hospital, touching ink pens, touching the countertops, my thermometer. Okay, everyone comes in and I take I start at the forehead and I go across to the hairline and then I touch behind their ear. That's the method we have for this thermometer. But it's then contaminated because it's touched every person that's come in. So each person that comes in, I wipe it down with alcohol, Clorox, bleach, whatever wipes I happen to have that day. So then it's no longer contaminated for the next person to come in. Indirect contact. Okay, we talked a little bit about that. It's interaction with fomites, droplets, or objects that can cause infection transmission. So touching objects, other objects, okay? Not necessarily touching the patient directly or having the patient cough or sneeze on me directly, but touching something that they have touched and then they've walked away. Infectious agent is just simply a pathogen that can cause infection. So any pathogen that comes into your body and causes infection is an infectious agent. Isolation. We're using isolation at the hospital right now too. Okay, we say isolation room and patients kind of freak out a little bit, but it is confinement to a private room to prevent the spread of infection. Okay, so in our case, if a patient, we're having a lot of patients that if you've been by the hospital, you can see that just east, so between the high school and the hospital, just east of the emergency room bay, there is a gray metal trailer. Okay, we've pulled it in the last couple of months, and that's where we're doing our drive-through testing. Okay, so if you're sick, your doctor orders the COVID test, you drive through there, the nurses come out, they swab your nose, they send you on your way. That, if someone comes in and they have that test, and then they still need to come in for maybe some blood work or an x-ray, then when they come in and tell me that that's what they're doing there, then I have to take them into a separate room. I have to put them in isolation. I can't have them sitting in the waiting room where maybe they're going to sneeze or cough and spread those pathogens around. Okay, so that's an example of isolation that I'm dealing with nearly every day right now. Is just, we're not locking them in there or anything, but instead of waiting in the waiting room, they're waiting in that isolation room where we know exactly what needs to be cleaned and we know exactly who's been in there, okay? Because it's not just people randomly coming in and sitting in there. Medical Waste Tracking Act. When we're talking about medical waste, we're talking about needles and gauze and Band-Aids and anything that has had bodily fluids on there, okay? Anything that's come in contact with bodily fluids, mucus, anything like that. So it's a government act that empowers OSHA to investigate the workplace's storage and disposable methods for medical waste. If you go into a medical facility, you won't see a nurse throwing away a bloody piece of gauze into the regular garbage. They're going to throw it away in those red garbage bins that are marked biohazard. Okay. And those have to be specially removed. They have to be specially transferred to a different facility, handled very, very carefully. Okay. There's a whole bunch of regulations that affect the storage and disposal of those medical waste. Methicillin-resistant Staphylococcus aureus. Okay, big long word, but it's a type of staph or bacterial infection that's caused by the bacteria Staphylococcus aureus, which is most common in healthcare settings, but is increasingly found in the community at large. Simply put, this is MRSA. Okay, many of you have heard of MRSA. Maybe some of you have had MRSA, but it's one of those bacteria that is now resistant to certain types of medication. Okay, so that makes it a little bit tricky. This is one that isn't necessarily totally alarming and we need to freak out, but it's concerning because you have to make sure that you know that that's what it is so that you treat it in the right way so it responds to medications. Okay, it originally was just something that was in hospitals. This was one of those healthcare associated infections. But now it's starting to get out into communities. Like we've had some issues with it with different sports. We've had some issues with the football team and the wrestling team and the basketball team. Okay, so it's definitely getting around in the communities, not just our community, but lots of communities. Mode of transmission. This is something I've mentioned several times already, but it's just the way that a pathogen moves from its storage or its kind of place where it's stored, its reservoir, to a new host. So it's the way it moves from one person to another, or from a table or an ink pen or anything like that, from one person to another. Occupational Safety and Health Administration. This is one that's been referred to multiple times already in several definitions, but this is just what we call OSHA. Okay, so it's an agency that works to prevent work-related injuries, illnesses, and deaths. So as a healthcare worker, it is an agency that is trying to protect us. Okay, many things are out there and set in place to protect the patients. This is one to protect the workers. Okay, so lots of things are going on with OSHA right now in as far as if a healthcare worker comes into contact with someone who's tested positive, then we have a special set of guidelines and restrictions and things that we have to log, symptoms and taking our temperature and things like that to keep us safe, okay, to keep us free from illness. There are safety things. So a job cannot have me working in a totally unsafe environment. They are required by law to provide me with a mask, okay? They're required to provide other people with maybe a gown and a face shield and things like that. So it just depends on your work setting and how much contact and how long a contact you're having with the patients, but those are all governed by OSHA. Opportunistic infection. If you think about opportunistic, you know that it's taking advantage of some sort of opportunity. Okay, so an opportunistic infection is a disease that takes advantage of an already weakened immune system. So something like right now, we're extremely, if you or I, and we're perfectly healthy and we do not have a weakened immune system, if we get COVID, we're probably going to be okay. Okay, we're probably going to maybe have a cough, sore throat, maybe a little shortness of breath, but we're probably not going to be severely affected by it, okay? We're probably not going to be the type of people that are going to need to be on a ventilator. We might, but most likely not, okay? But someone that already has a weakened immune system, maybe because they're on chemo, maybe because they have horrible asthma, maybe because they have a lung issue already. Those are those types of already weakened immune system, and those infections are going to take advantage of it. Pasteurization. This is something I think about milk when I hear this. Okay, but it's a process that uses heat to kill pathogens that can cause foodborne illnesses. So milk, cheese, all those things are pasteurized so that we do not get sick from any of those pathogens that are in there. Portal of entry. It's a body opening or a break in the skin that provides a way for pathogens to enter the body. Okay, today when I was working, I was using my little hand sanitizer and stuff in between patients, and I was sanitizing and disinfecting some wheelchairs. And I went and kind of used the hand sanitizer on my hand and kind of rubbed it around on my hand like we practiced with our hand hygiene a few months ago. And I found a break or an opening in my skin because I had a little cut there. Okay, so that's an area where I'm more susceptible to pathogens getting in because it's a little break in the skin. Of course, the mouth, the nose, those are natural body openings. So that's why they're what we're covering with masks right now to protect us from keeping those pathogens out. Portal of exit, the same thing, only it's a way for pathogens to leave the body. So again, my nose and mouth can be the same way. If I sneeze, I'm projecting those pathogens out of the body. Reagents. Okay, those are chemicals used in diagnostic tests to trigger desired chemical reactions. So these are some of those dyes and things like that that we put in before a diagnostic test to make sure that the test is working the way it is. So when I had my DEXA scan, I had a bunch of patients with DEXA scans today. When I had my HIDA scan and they injected that dye in to see how it traveled through my digestive tract, that was an example of a reagent. Reservoir, it's a place where pathogens can live. So either the human body, animal, food, on an ink pen, on a table, any of those things are considered reservoirs. Sharps. This is something we hear a lot too. Sharps are any sharp-edged object that can puncture the skin. So needles, scalpels, anything like that, they go into a designated red bin when we're finished with them so that somebody else doesn't puncture their skin with it while they already have bodily fluid from someone else on there. Sterile techniques. These are the practices of using sterilization to prevent the introduction of pathogens during invasive procedures. Okay, so when we go into surgery, they do a lot of sterile techniques to make sure that the environment is as clean and sterilized as possible. Okay, so they use sterile gloves, they use sterile products. They're not going to just grab a scalpel off of the shelf and start their incision that way. Okay, they're going to use a sterilized, very clean scalpel to start that incision. Susceptible host is simply anyone who can contract a disease. So right now we are all susceptible hosts. Okay, none of us are immune from contracting the COVID. Toxic, simply poisonous or harmful. Tuberculosis is a very serious bacterial infection that most commonly affects the lungs. And then before we had antibiotics, it was very fatal. Okay, it was generally fatal. That is all the vocab words for this chapter. I know this was a very long video and I apologize for that, but I wanted to get through these so that we can practice them. And then next week we're going to practice, we're going to review, and then we're going to kind of take, I don't want to call it a final, but just kind of a little assessment, I guess, to see how we're retaining information. Okay, it's not going to punish you. I do not want anyone's grades to drop because of it, but I just kind of want to see what we've retained and what we haven't. So don't stress. Please, please, please do not stress about it. But I wanted to let you know that that's coming. Okay. Of course, you can use any of your materials while you're taking it. It will be taken in your home, okay? And like I said, it will not punish you. It is not at all going to bring your grade down. I'm not going to let that happen, okay? I hope you guys are doing well. Hang in there. We're so close. We will be done with the year before we know it. And take care. Let me know what you need from me, okay, guys?